ना बस ठीक है।
हाँ ये मुझे भी
डन, सही है, दिखाना देना। ठीक है।
वैक्यूम कितना है?
बस बस ठीक है, सही है। थैंक यू। नहीं कोई नहीं, मैं थोड़ा अपने इंस्ट्रूमेंट देख लेता हूँ। तुम थोड़ा उधर हो जाओ थोड़ा सा, और मैं एक बार इंस्ट्रूमेंट चेक कर लूँ। तुम्हारा रैक्सिस फोर्सेप्स कौन सा है इनके पास, कौन सा है? वही है।
You are
Dr. Prasad, good
You are
morning.
like-
Dr. Prasad, good morning.
वही निकालो।
I think आवाज नहीं जा रही ऊपर।
नहीं डायलर तुम्हारे पास होगा ना, डायलर तो बस ठीक है।
Dr. Prasad, can you hear me? Hello. Dr. Prasad, can you hear me? नहीं, आवाज नहीं जा रही।
ठीक है, मेरे दो हैं रैक्सिस।
So for the audience, we have a live surgery transmission from center of
तो
sight,
ठीक चलेगा वही।
and the surgeons will be putting lens by VSY. So the two lenses
नहीं,
that are going to be
मुझे
implanted
एक
today
वो क्या
are
कहते हैं,
Innova by VSY
वो
and
दे देना।
TriNoma by
तो तुम्हारे
VSY.
पास forceps, कुलिबरी फोर्सेप्स है इसमें, कुलिबरी या फोर्सेप।
The surgeons today are Dr. Rajendra Prasad and Dr. Anaga Haroon.
स्ट्रेट है ना, बस ठीक।
At the panel, we have Dr. Alkesh Chaudhary, sir. I'm Dr. Anchal Gupta, Dr. Nikhil Seth, and
लाइट स्टार्ट हो गई?
Dr. Kia Burman.
हैं?
your name is not Doctor?
नहीं आ रहा,
Dr. Kia Burman.
ऑडियो नहीं
So
आ
we all set for a morning session. I think the voice is not going to the center.
Ram,
Dr. Rajendra Prasad, sir, can you hear us?
नहीं इसमें तो आवाज, मुझे नहीं आवाज आ रही।
Dr. Prasad, can you hear?
हेलो हेलो हेलो
Doctor, yeah, we can hear you.
हेलो, हाँ डॉक्टर अलकेश, गुड मॉर्निंग।
Very good morning, Dr. Prasad.
Very good morning, Dr. Prasad, sir.
Can
How
you
are
just
you?
highlight your surgical things?
Yeah,
What are
thank
you
you.
going to do and which lens?
थैंक यू वेरी मच।
Sir,
So
what lens are you going to implant today? We like the
So-
cap though.
Yeah. So I am going to operate on a little harder cataract, around grade 4 to 5 nuclear sclerosis. And the lens which I am going to implant is Innova from VSI Biotechnology. This is one of the very good lens which I have been using now for the last few months, and it's one of the good innovation from VSI Biotechnology. Glistening-free lens, it's a hydrophobic lens. It has a spherical aberration of around -0.1, which is ideal for any situation. And this lens has the biggest point with this lens is it has a temperature control. This lens can be used at a -2 degree to even higher temperature also. The lens will not have any deformation while implantation or keeping it. So this is one of the very good lens, and the best thing what I found was this is very compatible with the eye, and I have not seen any posterior capsular opacity with this lens because it's a 180 degree square edge. It fits on the capsule very well and takes up the capsule into it, tucks to the capsule. And even while implantation, the lens is beautifully, it goes inside, which I'll be showing. And I'll be using one of the very good dispersive viscoelastic which has come up now. This is called as a Protectalon. It's a 3% sodium hyaluronate. I think this is also from the biotechnology, VSI Biotechnology has come out with a very good viscoelastic, and it has a quality of dispersive. It's not adaptive. So although it is a sodium hyaluronate, but it's a dispersive viscoelastic, and gives you very good anterior chamber retention and protects the endothelium very well during the emulsification. Thank you.
All the best, Dr. Prasad. Indeed, the best part about the Innova IOL is the temperature regulation. It has a TG value of -2,
Yeah.
which is the best in segment. And even in the coldest of region, we as surgeons, we are aware, especially in Delhi, that a hydrophobic lens becomes very, very stiff as the winters peak in. But with Innova, the lens opens extremely smoothly, whatever be the temperature. That's a real fantastic feature which I have experienced while using the IL.
And besides, once we fit in the bag, it fits so nicely. It's well centered. It doesn't get displaced. You need not to recenter or something. You do like that. So it's one of the very good lenses. And no glistening, zero glistening. Even post-operative, the results are very good and patients are very happy.
Right. So as you can see, the cataract, it's a brownish cataract with grade 4 to 5 nucleus crosses. And I am sitting on the top, and I'll be operating because of its K1, K2 factor. I'm going to operate it from the superior nasal quadrant. All right. Blue lens. So I'm going to stain the capsule with the blue Rex. This one. So this is, I'm going to use protectalon. This is sodium hyaluronate. And the important point is you have to go on towards the other end of the pupil so that you evacuate all the aqueous from the anterior chamber and evacuate the side wall. I generally make a groove and make a triplanar incision, a valvular incision.
आइए
So I normally use Rexis forceps only.
सीधा रखो और देखो हो गया बस स्वाब देना स्वाब स्वाब
Now slightly decentered. Kindly recenter it.
So I made almost 5.5 millimeter of Rexis. That is,
Dr. Prasad, this entry point is 2.8.
hello, yes, yes.
This main port is your...
Main port is 2.8, yeah.
Yeah.
सीधा रखो हो गया लाइट में
I do it.
Very nice capsular access done with the strata
So you can see the hydro
So
and
Beautiful delineation, golden ring.
yeah.
Brilliant golden ring.
इंट्राकैमरल है
Right.
very nice.
सीधा रखो, सीधा रखो।
Hydro delineation, hydro dissection, excellent.
Kindly recenter the. Kindly recenter
So
it.
for a good phaco, it's extremely important that both the steps, delineation and dissection, are properly done, so that we don't
Lari
waste
sir.
our time during cortex removal.
Yeah, so
मलाई
I
नहीं,
normally
इसे
use
वैसे रखा हुआ
viscoelastic also to
डाल दिया सर
separate the epinucleus from the nucleus. So this helps for me
ना इसमें थोड़ा रैप करो
using my technique of terminal
क्या?
chop, so that your nucleus is absolutely free from the epinucleus. So this is how I dissect the nucleus away from the, as you can see the nucleus has already moved and it's free now. And
वाह हो ही गया लेट हो गया इतनी जल्दी में होता नहीं
so this is the device which I am going to use. This is my terminal chopper. This is called as a terminator.
इधर से ही है ना
And
So we are fortunate to watch the implantation of Innova and Terminator chop both in the same sitting. The merits of having Dr. R.P. sir as the surgeon.
thank you. So you can see the nucleus is free now. This is very important step. You have to make the nucleus free. And if your nucleus is free, then it becomes very easy to chop it.
And what is your aim of keeping this capsular exercise?
So the machine which I am going to use is the Sovereign Signature Pro, and I hope this will give me a good control on the nucleus and taking away the pieces. So I'm just trying to remove a bit of nucleus from the area where I have to chop it. Chop. So you have to impale it from the center, as you can see here. I'm going towards the periphery. On one side, hold the nucleus, draw it a bit, hook it, and crack it. I'll just take it on the other side to get the complete crack of the nucleus.
क्या करना है?
Chamber low हो रही है. Right.
मैक्स से ना बोल
हाँ. Cornea vector. Cornea vector. All right.
So he has rotated the lens 180 degrees so that he can extend the chop from the other side. And
Now you
very
can see
good.
the nucleus is now into two free segments, complete free segments. And I'll take suck it. सर जा रहा है. ठीक है. I'm taking the first segment. Like.
थोड़ा सेंट्री कर दिया। नीचे हाँ उल्टा उल्टा उल्टा
ठीक है।
और बस ओके So he's again bisected the quadrant.
I'll be taking up each and one by one all the quadrants. And, the most important thing what you can see now here is most of the quadrants are now free. So you don't have to struggle much in bringing these quadrants on the Pico Pro.
How nicely he has brought the part of nucleus that was sticking near to the incision. Because sometimes if you have these fragments staying back, they cause inflammation for a long time.
Needle is volume. No. Okay. Cassette blocker. This can happen with the harder cataract because many times these hard nuclei would block the tubings or the picoprobe. Now as you can see here, now this case, I'll have to take it out and
Visco.
So whenever there is a chattering and the pieces are running away, I have found that filling the center with visco helps in bringing them right into the center.
जल्दी लाओ फ्लश कर दो थोड़ा लेंस रेडी रखिए हम लेंस को लोड करके रखें
क्या होगा
Okay, I'm restarting it and because of the clogging, I'm going in again.
Happy?
Happy? Lens load करते रखो आइए 5 मिनट
So he's using a bimanual.
Yeah. Irrigation and aspiration cannula, and this gives you much better control, and so that you can take out the epinucleus from any part of the.
I absolutely agree with you. I also use the bimanual. There are some habits which we have from the rest of India. I think North people use don't use the bimanual, but this gives you much better control, and this gives you much better clearance of the cortex, especially subincisional.
Polish. Saline डालो, saline डालो, saline. Cornea wait करो.
Cornea wait.
So I just wanted to ask all the rest of the panelists and everybody, how has been your experience with the lens Innova? And what kind of A constant do you use in this? Do you have your any personalized A constant for this lens?
So, so the company provides the constant for both ultrasound and optical. And
So
for
this is the lens I'm going to implant, Innova.
ultrasound, it's 118.8.
And
And of course, we, with our own practice, we realize that, you know, at what we should aim it at myopia or we should aim it at emetropia. But by and large, in my practice, the results have been extremely good. With the A constant, they have provided standard for the ultrasound use, gives very good result. And now as the lens unfolds, we can see that it unfolds very beautifully. It doesn't feel that we are opening a hydrophobic. It opens just like a hydrophilic lens.
So you could see the smooth
Another
opening
part,
and
the good part is
wound assisted.
haptics never stick on the optics.
Yeah.
Absolutely.
So haptic and optics,
Yes,
they are remain
yes.
separate. Like
Yes,
sometimes you
mostly
will
with
find in hydrophobic,
pure hydrophobic
your
lenses.
haptics are sticking on the optics, so
Yes.
sometimes becomes difficult to separate those haptics from the optics.
Yes, so in our practice with pure hydrophobics, the haptics, they tend to stick on the optics, and for
So
which the
that is
best
a
solution is we
advantage, yeah.
put visco on the hydrophobic, on the haptic of the lens. But in such case, such sticking problem doesn't happen at all.
Okay.
Excellent surgery, Dr. Prasad.
Yeah. I
Dr.
think,
Prasad, nice surgery done. Excellent job done.
yeah. So we are shifting to the other OT now.
Right,
Okay.
right, sir.
Okay.
Ji, sir.
Right, sir.
Brilliant surgery, sir.
So the second surgeon
Doctor
is with the trifocal TriNoma lens of this.
Hello. Hi everyone. Chachaji, light.
Dr. Anaga Haroon is operating surgeon.
Dr. Anaga
Dr.
Haroon is the operating
Anaga
surgeon.
Haroon from Bombay.
Can you hear us?
So Dr. Haroon is going to implant a
Hello.
trifocal lens by VSY,
Hello.
which is different from other trifocals.
Yeah, hello.
Yes, sir.
Yes.
We can hear you. Yeah, Anji sir.
Yeah, you are having the signal now. Give the microscope signal from OT2, please.
Yeah.
Right.
Yeah,
sir.
can you see the microscope signal?
Yes, we can
Yes,
see
sir.
that.
Okay, fine. So we
Yeah.
over to Dr. Anaga Haroon from Mumbai.
Hello everyone. A very good morning. Chachaji, आपको सिर्फ लाइट में देखना है. Okay? We'll be starting the case now.
So,
Ma'am, you can be
increase the
little
volume
louder.
because we are not able to hear
you
you,
hear
Dr.
me?
Anaga.
A little
your
louder.
volume needs to
yes, we can
increase.
hear you.
Yeah, so I'm just doing the side pokes. Can you have ocular please? Yeah. सामने देखते रहना है.
She's
इसको
injecting a little bit of Oculon, I suppose, or Pinokin, I don't know.
नहीं ocular that was, and this is plain HPMC. So we need to be very careful when we are injecting visco or anything inside the eye. Since के होते हैं ना पहले, so that we don't create a DMD. Light में देखना है चाचा. ये देना है केराटोन देना.
So the lens Dr. Anaga is going to implant is a trifocal, which is a trifocal with a SVT property,
Right.
that is sinusoidal wave property,
Saline डालना.
that hardly causes any glare and halos, and it's very close to how a natural lens behaves.
Light में देखना है.
Another great thing about the TriNoma is that it has the highest light transmission, almost 92%,
Making a 2
which is
millimeter
very
incision
close
tunnel.
to a 38-year-old
Ocular.
human being's lens. So it's extremely close to what a physiological vision would be with a near add of +3 and an intermediate add of +1.5.
So our basic.
So I think she has made a
CCC
2 millimeter incision.
And having a very high Abbe value, which
Yes, it has the
reduces
highest.
It has
the
a Abbe value of
dispersion.
almost 58, which is one of the
Yeah,
highest.
that's the biggest advantage.
चाचा जी
So-
लाइट में देखना है. हाँ.
So light dispersion is the lowest with these TriNoma lenses. So the people are very comfortable after this lens.
And moreover, there is a value addition, quite a good range of diopter powers available, 0 to 32.
0 to 30.
Usually it's paying 5 to
Usually 6,
29,
7,
30.
Yes.
Yeah.
6, 7 onwards.
Even when you're thinking about refractive lens exchange, that's extremely
So
helpful.
like high myopic
True.
patients who are having low power. So
Hydro देना 2 cc.
So that's an
2 cc
excellent
saline.
Rexis. You
Excellent
don't need a
2 cc
femto, I
saline.
suppose, for her.
Yes.
2
Excellent
cc में
Rexis.
देना. Rexis is slightly on the smaller side, but I prefer to do it instead of very large Rexis. So whenever we start the hydrodissection, always press the posterior lip and remove a little bit of the visco so that you don't inflate the bag too much. Lift the anterior capsule and a gentle hydrodissection. Can you put saline please? Light में देखिए चाचा. हाँ बस देखते रहना है.
So you saw that wave going.
Light में देखिए नीचे. हाँ. Yeah. So in very small quantities in 2 or 3 places. Press the posterior lip.
So she set the settings on soft cataract with a panel aspiration of 26.
Light में देखिए ना चाचा.
Vacuum of 40 going to 650 and linear 60% power.
It's a very soft cataract. So sometimes these soft cataracts can be a little more difficult. No, it's good. Don't Sinsky देना. दो dialer. So let's see if it rotates. Can we increase the illumination in the microscope?
Microscope की illumination.
We have 3 minutes for this session.
Saline डाल दो. Saline please. Yeah. Yeah.
So the nucleus is
फेंको देना.
nicely freely rotating.
So it's rotating well. थोड़ा सा पानी आएगा चाचा जी, थोड़ा प्रेशर आएगा आँख पे. सिंस की हाँ सामने देखते रहिए लाइट में. चॉपर नहीं चाहिए. इट्स अ वेरी सॉफ्ट कैटराक्ट. आई डोंट थिंक वी नीड अ चॉपर फॉर दिस. लाइट में देखना है चाचा, देखते रहना है. सो जस्ट रिमूविंग द सुपरफिशियल कॉर्टेक्स एंड एपिन्यूक्लियस. सलाइन डालना प्लीज. Saline डालिए. Such very soft cataracts usually don't. You don't need to do a direct chop. नहीं हिलाना नहीं. So I prefer to do a stop and chop. So you need to deepen the trench a bit. थोड़ा एक ड्रॉप सलाइन डालिए. चॉपर देना छोटा सा वो है ना.
So we have gotten 2 pieces. Now we are going for the quadrants.
हाँ जी.
Vacuum is now increased to 400.
अच्छा देख रहे हो. So there's a little bit of conjunctival.
So as you can see, Dr. Alkesh.
Yes.
As you can see, Dr. Anaga has already broken the lens into 2, and she is
into
now removing
very
the
nicely
second quadrant. Yeah.
Handing of the nucleus, soft
Yeah.
nucleus. Yeah, very nice
So
handing.
very nicely removed the whole nucleus.
Dividing
So I've
and
changed to
taking all
epinucleus
the
mode in
parts
the last
nicely.
few. हाइड्रो देना मुझे इसके बाद.
And Dr. Anaga is going to implant, I think, TriNoma.
हाइड्रो.
So you all know that TriNoma is one of the trifocal lens which has come from the VSI Biotechnology.
नहीं
And,
आए देना आए.
This lens is, I personally have been using, I have used more than 500 lenses of TriNoma by now. And results
doing a
with the
second
TriNoma
hydro
are
actually
highly satisfactory.
Because there's a lot of cortex.
This lens gives you a very good distance, unaltered distance vision, very good near vision,
Yes.
around 60 centimeter, and very good intermediate vision also. So this is the TriNoma lens. And Dr. Anaga is, I think, one of the surgeons who's using this lens quite frequently.
Yeah, I've used quite a bit of these.
So you can tell Dr. Anaga your experience with the TriNoma.
Yes, yes. I've used quite a bit of these lenses and they work really well. They have almost 12 stepless
I think time for the session is over. So one very important step what Dr. Naga was doing, whenever we are stuck with the epinuclear stage, instead of going again and again with a phaco probe, it's always a wise idea to do a good hydro again and separate the epinucleus thoroughly. That saves a lot of time. So that's exactly what Dr. Naga was going to do. But the session is over and we move to
thank you all the panelists, Dr. Achal, Dr. Alkesh, Dr. Nikhil, and now the next session will be from 11:30 to 12, live surgery transmission from I7, and I invite Dr. Bharti sir, Dr. Daryal Mathur, Dr. Piyush Kapoor, Dr. Rajesh Sinha, Dr. S.K. Narang, Dr. Rajiv Bajaj, and Dr. Jitendra Bali for the next session.